Hi, I'm Dr. Ben LaHood. I'm going to talk about the case for hydrophilic IOL materials. Got some financial disclosures, but nothing relevant to this presentation. So my experience, I've been putting in hydrophilic IOLs for a number of years, over the last 8 years. I put in different designs, monofocal torics, monofocal plus, multifocal, and they work really well for me. The biggest benefit that I see with hydrophilic IOLs is the small SIA. They go through a really small incision, and so SIA is very unpredictable. So if we can minimize the amount of unpredictability, we can get more reliable refractive results. And that's with hydrophilic lenses going through smaller incisions. They don't get glistening. So when you put a hydrophilic lens inside the eye, they look beautifully clear, beautiful at the slit lamp, beautiful vision for the patient, and they're not going to degrade with glistenings. We can get different optical designs more easily with hydrophilic materials. So you get optical designs that you wouldn't necessarily be able to get with hydrophobic lenses. And so that means a more choice for your patients to give them a customized outcome for their vision. I'm a big fan of this. Toric IOLs in my life. I spend my life treating astigmatism. I want the lens to completely unfold during the course of the operation so that it's unfurled and it's not going to rotate after the operation's finished. And so with a hydrophilic material, that happens a lot quicker. It's a lot more stable within the eye, as opposed to a slowly unfolding hydrophobic lens, which could rotate later on. I think that this might seem like a negative, but you will have patients where you'll want to exchange their lens. They're not perfectly happy with their outcome, especially when we're doing different optical designs, more advanced presbyopia correction. You will have patients that are not perfectly happy. If you do need to take out a lens, I would much prefer it to be hydrophilic, easier to fold it out of the lens capsule. It's just an easier experience. It's not an operation I enjoy, but if you do have to do it, we want it to be easy. This is the elephant in the room, the opacification risk. The risk with hydrophilic lenses, I believe this has been a bit of a witch hunt. The risk is a tiny risk of a risk. So if we are putting these lenses into an eye that we know has some risk of needing a gas bubble, that would be something you'd want to discuss with the patient. But in general, if I'm putting a lens into an eye that has Fuchs dystrophy, an epiretinal membrane, I would probably avoid a hydrophilic lens. But for everyone else, that risk is absolutely tiny, and it's something that I think personally, and I think a lot of people agree with this, has been blown out of proportion compared to the benefits of a hydrophilic lens material. The other slight negative with a hydrophilic lens would be the rate of PCO, posterior capsular opacification. Now, doing a YAG capsulotomy, I don't think it's a problem. It's an easy procedure, it's a safe procedure, and to be honest, we make money from that procedure. So all in all, it's not a negative, and they do have a slightly higher risk with hydrophilic materials than hydrophobic. But the RayAcryl material from Rayner has an incredibly low rate of PCO, 1.7% over 24 months. So for this material in particular, it's really equivalent to a hydrophobic material. So specifically with the RayOne EMV toric lens, which I've been using over the last year, I found excellent rotational stability. I've loved that it gives a natural range of vision. So my patients, especially the younger patients, they maintain that similar to being pre-presbyopic. It really had minimal side effects. I've never taken one out. Excellent vision quality, and most importantly to all surgeons, it's predictable. Getting really good results. Exactly what I plan is what we're achieving. So overall, on hydrophilic materials in general, we've got smaller incisions being possible to minimize SIA, give a more predictable refractive outcome. Excellent optical quality for the patients. Getting more variation, giving the patients more options of what they might want for their vision. Rapidly unfolding, so toric ability within the eye is nice and stable. Very easy to explant, and a very, very acceptable side effect profile, pretty much nothing. So in my hands and in my experience, I'm a big fan of hydrophilic materials, and I think everyone else should be too. Now, I've written some articles recently about hydrophilic materials, their pros, their cons, the case for them. I've got some references here if anyone wants to read them. They've been available online freely. And we've also done a podcast, a peer-to-peer podcast from Rayner with Professor Gerd Alpha. The tiny worries about using hydrophilic lenses are massively overshadowed by the benefits. So for me, The big benefits would be going through a smaller incision easily, so smaller surgically induced astigmatism, more reliable, predictable results. If a surgeon really wants to avoid any risk of opacification, you'd avoid putting a hydrophilic lens into an eye that has any risk of having gas put in it. So you'd want to avoid putting it into an eye with Fuchs endothelial dystrophy, or maybe with an epiretinal membrane, somewhere where you're going to be putting gas into an eye at a second operation. If you did have to put gas in at a second operation, you'd want to minimize the volume of gas and minimize how long it's inside the eye for. I think they're really realistic ways of minimizing that risk. There are more technical ways you can do it, but for the average surgeon that's wanting to minimize their risk, I think they're very manageable ways of dealing with that risk.